lot of persons currently HIV positives are actually suffering from opportunistic infection, unknowing that there are vaccines that are being provided for HIV patients to help them fight or prevent all these opportunistic infection. Hello everyone, it's Esther Maka Ugbe. On this channel we discuss everything about health, HIV precisely, and little about business and lifestyle. So today we'll be talking about opportunistic infection. What are opportunistic infection? These are actually infections caused by microorganisms like bacteria, fungi, virus, and parasites, and these microorganisms affect individuals with weakened immune system. When we say weakened immune system, individuals that their immune system is not working as it should. So these microorganisms are able to cause infection in individuals because they are suffering from what is known as immunodeficiency disorder. Immunodeficiency disorder is a condition whereby the immune system is not functioning properly. The immune system is weakened and cannot do that which it's supposed to do in a normal day. The other conditions that might lead to this opportunistic infection, one of them is age. Most advanced persons that are on HIV medication actually suffer from opportunistic infection because their immune system is already weak. Just imagine, you cannot compare the immune system of an adolescent and that of an aged person. Another condition that can also lead to opportunistic infection is cancer patients that are on treatment because their immune system is not as strong as it should. Another thing is malnutrition. Yes, just as most times we are always emphasizing this malnutrition. Eat well, eat healthily, drink water, eat protein, eat fruit. Is actually important because it helps your immune system to actually be strong to be able to withstand opportunistic infection. Those persons that have one of the or two of their organs transplanted, that might actually be another risk factor for opportunistic infection. If you've watched this video to this point, don't forget to give us a thumbs up and subscribe to our YouTube channel, and also share. You sharing this YouTube video, it will help you get to persons that need this information, and also you'll be helping us prevent and reduce stigmatization and sharing the knowledge about HIV infection. So let's continue. Let's briefly talk about some of these opportunistic infections. There are many, but we'll mention some of them. One of them, and the number one, is tuberculosis. Yes, most persons, the only opportunistic infection they know that affects persons living with HIV and AIDS is tuberculosis, but there are more than that. There are a lot of opportunistic infections that people living with HIV suffer from. Tuberculosis is one of them. Another opportunistic infection is candidiasis, also known as oral thrush, which affects majorly the mouth, the throat, and the female vagina, causing some white particles and patches around it. Another opportunistic infection is pneumocystic pneumonia. Yeah, symptoms are things like fever, headache, shortage in breath. This is actually one of the major causes of death among people living with HIV infection. We have cryptococcal meningitis, which is also an infection of the brain. We have Mycobacterium avium, we have AIDS, we have Kaposi sarcoma, we have IVAN, we have hepatitis B, hepatitis C. We have lots of them, even those we didn't mention in this video. We have a lot of opportunistic infection that affect persons living with HIV and AIDS. Most of these opportunistic infections can be major, some of them can be minor. When we say major, it's obvious, you can easily see it, and most persons are always suffering, but they have those minor. Most of those minor opportunistic infection, it does not even give a sign. Like, even though you are living with it, you might not even know because it's not affecting you. It doesn't have signs, doesn't have symptoms. And some of them, over time, it goes out on its own when you adhere to your medication. But some of them, you need to treat them differently, even when you are taking medication. So as person living with HIV and AIDS infection, if you notice unusual signs and symptoms around you, unusual itching, unusual symptoms, or unusual swelling, unusual rashes also, make an appointment and see your doctor. You need to be checked and screened for opportunistic infection. So we've mentioned some of these opportunistic infection. We've defined what opportunistic infection is. So how do we prevent and manage opportunistic infection? One of the most efficient way of preventing OIs is taking your HIV medication. Because you are taking your HIV medication, it will help your immune system build up, and it will also help you fight against other infections that would have had chance of coming in because of your immunocompromised system. Another way of preventing opportunistic infection is we have prophylactic medications like cotrimazole, which is also known as Septrin, that is given to prevent toxoplasmosis and other bacterial infections. We have isoniazid preventive therapy, which is also given to prevent tuberculosis infection. Also, another way to prevent and manage it is regular monitoring. Yes, constantly check your CD4 cells Check how high your CD4 cells are and how low it is to know what next step to take. Always check your viral load. Your viral load will enable you to know the length, the extent at which the virus is in the system, the amount of virus in the system, to know if the medication you are taking is working or there is need for switching. So regular monitoring can also prevent and help manage OIs, your CD4 cells and your viral load collections. Another one is healthy living. Yes, healthy lifestyle. Eat properly, eat nutritious meal, eat well, drink water, take fruits. Another one is practicing safe sex. Yes, for both married persons and singles that have HIV infection. Speak to your healthcare practitioner, discuss with them. They can also give you preventive measures and the best practice for safe sex. Another important thing is to always maintain a good hygiene. Ensure that your environment is clean. Ensure that your kitchen where you are cooking your food is clean. Ensure that your sitting everywhere is clean. Your environment is clean. And yes, uncooked or raw food, also avoid them. Generally, just practice healthy lifestyle. It will do you a lot of good, and not just for persons living with HIV. Even as an individual, practice healthy living, practice healthy lifestyle, exercise when is necessary, drink water when you should, eat fruit when you should, eat healthy meal, eat enough protein, and keep yourself safe and ensure that your immune system is always in good condition. I will always say, what is the benefit of always looking after your physical body when your immune system is dying? What's the point of spending your money looking good physically and your immune system is not taking it? And also, in summary, there are vaccines that are available and recommended for persons living with HIV. We have vaccines for hepatitis B, influenza, and pneumococcal vaccine. I hope I pronounced it well. These vaccines are made available for persons living with HIV infection. If this is the kind of video you love to see, don't forget to subscribe to this channel and stay tuned. Turn on your notification bell so that whenever we upload videos, you will be able to see the video and learn one or two things. This channel is not just for persons that are living with HIV. This channel is also made to enlighten us on what we should know about health generally and HIV precisely. Learn, understand, share the information so that at least you help a lot of persons to come out from their share, accept their status, retain them on care, help them to take their medication, and support them the little way you can. Until I see you in our next video, don't forget, hope you've subscribed before you've gotten to this point. Hope you've subscribed, hope you've liked, and if you want any part of this topic, if you want us to discuss a particular topic around HIV, you can also drop the topic on the comment section. See you in our next video. Bye bye.